This is the last video on a series on hepatitis and will discuss treatment and prevention. These are some of the general principles in the treatment of hepatitis. Bed rest and a high-calorie and low-fat diet will suffice for most patients with acute hepatitis. Hospitalization may be required for some patients who may need intravenous fluids, particularly if oral intake is poor or if there is persistent vomiting, or if the doctor deems that the hepatitis is severe. In acute hepatitis, it is best to avoid drugs that can have adverse effects on the liver, like paracetamol, painkillers, and alcohol. There is no specific medication for acute hepatitis A, and most patients will recover within 1 to 2 months. Most adults with acute hepatitis B will recover within 6 months. Some doctors may decide to start on antiviral medication to hasten the recovery process. Acute hepatitis C, doctors may treat with antiviral medicines to hasten recovery. Some doctors may start antiviral medications as soon as the patient is diagnosed. Others may wait for 3 months and see if the virus is still present in the blood. And if virus is detected, then treatment is initiated. Treatment of chronic hepatitis B and C, fatty liver, and hepatitis due to alcohol will be discussed in separate videos. Autoimmune hepatitis is treated with steroids and immune suppressing drugs like azathioprine. They are effective in over 3/4 of patients. There are specific treatments for iron and copper overload, which remove the excess iron and copper from the body. Let's now discuss on how we can protect the liver. First thing is vaccination against hepatitis A and B. Ensure that one has been vaccinated against hepatitis A and B. For hepatitis A, it involves giving 2 doses of the vaccine at 6 to 12 months interval. Hepatitis B is 3 doses over 6 months. For the combination hepatitis A and B vaccine, up to 4 doses may be needed. Typically, all newborns are given the hepatitis B vaccine. Both hepatitis A and B confer long-term immunity. If you do drink alcohol, do it in moderation. The video on alcoholic liver disease will discuss what is the safe limit for alcohol consumption. Regarding herbs or supplements, do not take it without doctor's advice. These are some herbs that could be toxic to the liver. Some of these have been linked to hepatitis, and this includes comfrey, the plant is shown here, aloe vera, pennyroyal oil, which is used in teas, and coltsfoot. These are more herbs that could be liver toxic. This includes kava, ephedra, germander, and chaparral. Keep in mind that not all natural or herbal supplements are safe, so always check before taking herbs and supplements. Problem in most countries is that herbal and dietary supplements are not regulated by the drug control authorities. Be careful when taking over-the-counter drugs that can cause liver damage. These include painkillers, also called non-steroidal anti-inflammatory drugs, and paracetamol if taken in excess. Food safety is also important. To protect against hepatitis A and E, avoid drinking local water and iced drinks and eating raw fruits, vegetables, salads, and raw or uncooked shellfish like oysters, especially if traveling to resource-limited countries. Always stick to bottled water and avoid eating raw foods if you're visiting a country with poor sanitation and drinking water. Always wash your hands before coming into contact with food. Also, practice proper hygiene if you are a close contact of someone with hepatitis A or E. To protect against hepatitis B and C, always practice safe sex. To protect against hepatitis B and C, do not share toiletries. Do not share toothbrush, razors, nail clippers. Regarding tattoo and body piercing, always ensure that the salon is serious about hygiene, particularly that the tools are heat sterilized and needles are disposable. Finally, how about hairdressing salons? There is a small risk of transmission through grooming items. You can reduce the risk by bringing your own razors, nail files, and clippers.